down to the bottom of your screen, there'll be a menu bar, series of options that come up. One of the items is, it looks like a person with 3 lines beside them. If you click on that, you can see everyone that is participating in the meeting. You can mute yourself by hovering over top of your name. There's a mute option there. There's also an option to raise your hand there. I'll do a few minutes of a set speech, and then we'll go into questions. I'd ask that when you have a question, please keep yourself muted. Steve Guthrie, you're calling in, so we'll do it a little bit differently with you. If you have a question, please raise your hand. The process that we'll go through will be, you can ask a question and have up to 2 follow-ups on it, or 3 separate questions. Then we'll move on to someone else so that we're able to get through everyone. If you have multiple questions, that's okay. We'll come back around to you. Steve, for yourself, what we'll do is I'll let you ask the questions first when we get to that, because you don't have the ability to put your hand up, and then we'll come back to you again after everyone else has asked questions. Thank you very much again for coming today. I do greatly appreciate this. It has been a very trying time for us. We have a lot of things that are changing, not only on a daily basis, but on an hourly basis with COVID-19. I'm going to give you an update on what's happened in the last 24 hours with the Ontario government, and I'll start with yesterday's announcement of $50 million for Ontario Together. Through Ontario Together, we're investing $50 million to help companies ramp up, make whatever changes they need to so that they can provide the PPE to the province. In particular, one company that has taken advantage of this is O2 Technologies. They have retooled and can produce ventilators for us. Ontario has ordered 10,000 ventilators from them, and our expectation is that they will be delivering very shortly. It won't be all 10,000 at once. It will be staggered, but that'll put us in a much better position as we move forward to deal with COVID-19. We do not have 10,000 people right now who are infected with COVID-19, but we want to make sure that we're in a position where we have all the resources at the hospitals that we need to have to make this work. We also announced today $2.2 million in supports for domestic abuse. With the self-isolation, with the social distancing, we're seeing that the incidences of domestic abuse have gone up, and we want to make sure that we have the supports in place to help people who need that help. We've also announced today $12 million for mental health programs. Now, these will be delivered predominantly online or through telephone services. A couple of examples of that: the Kids Help phone, for one, will be receiving additional support through this program. There are other programs available as well, and we'll send out all of the companies or all of the organizations after this press conference is over so that you have all of that information. We're also investing slightly more than $2 million in mental health for our frontline healthcare workers. We recognize that they're under a great deal of strain right now. We'll be hiring 6 additional psychologists for the province to make sure that we can help those individuals who are on the front lines right now, doing the work, keeping people in Ontario safe. About a week ago, the Ministry of Municipal Affairs and Housing announced $148 million to help our homeless community. Today, I'm announcing $1.1 million for Peterborough for this. This money is used or will be used for additional PPE for those frontline staff members. As well, our homeless community is in, the shelter has been moved. They are staying right now at the Sport and Wellness Center. There are some additional costs that the city has to pick up for that. Transportation is one of them. We'll be helping to cover the transportation costs. One of the challenges that we have with our homeless community is they don't have the ability to self-isolate at the moment. Some of this money then will be used so that we can have hotel or motel rooms for them, so that those who are showing signs or symptoms of COVID-19 have the ability to self-isolate. We'll still be providing, the city will still be providing daily visits to them, but they'll be in a position where they'll be behind the motel room door. Our staff or the city staff will not be in direct contact with them that way, but they will still be able to check up on them. They will still be able to communicate with them. And it allows for a safer self-isolation for some of our most vulnerable people. We're providing $52 million in direct supports for the cost of food, rent, medicine, and other services. This is being delivered through the municipalities, through the Ontario Works staff. If you're in a position where you need extra help that way, you can reach out to the Ontario Works administrative staff in the municipality here in Peterborough, and there are supports in place for that. We've received a number of questions from parents concerned about their children who are in grade 12, who have not completed their volunteer hours, and will the volunteer hour requirement still be there for students in order for them to graduate? Through the Learn at Home initiative, there will be the ability to complete your your volunteer hours online. That'll all be rolled out as part of the portal that the students will be going to next week. Teachers are being taught on how to use it as we speak. It'll be available for the students early next week. One of the options that a student can do is to check in on seniors. They would be doing so by calling in or by doing something across the internet and then tracking their volunteer hours that way. We know that a lot of our senior population, they are at home, they are isolating, but they are also isolated. This gives a community outreach for them and will help with their mental health. Our list of essential services is going through an adjustment. We have a cabinet subcommittee that is reviewing all of the essential services that we have listed right now, and we will be making adjustments to it in the very short term. It may be tomorrow, it may be Saturday, but in the very short term, there will be adjustments being made to our list of essential services. Ontario is on the precipice of a potential surge in COVID-19 cases, and we need to do everything possible to reduce the amount of contact between people. And the last thing, tomorrow, Premier Ford will be releasing information about the COVID-19 projections, where Ontario was, where we are today, how the measures that we have taken so far have reduced the number of infections, and projections on where we will go if we don't continue this path. It'll be some very sobering information that'll be presented tomorrow by Premier Ford on it. Premier Ford has been very clear that he wants to be as transparent as possible and give everyone as much information as possible. We're the first province to announce that we'll be doing this. Premier Ford will be part of a First Minister's meeting virtually tonight with all the premiers of the territories and provinces, as well as the Prime Minister. Before I open up the before I open up the lines for questions, I've just gotten a notification from my computer that the battery is low, so bear with me 1 second while I plug it in. Sorry about that. Does anyone have any questions? We'll start with Steve Guthrie because Steve isn't able to raise his hand. Steve, do you have any questions?
Yes, thanks, Dave. The question I have is about the getting some of the homeless into a situation where they can self-isolate. Now, this would be like hotel, motel rooms. Is this something that you've solicited hotels in the area about, or is this something that you can simply go and say, we're taking these rooms? How does that work?
The Social Services Department at the City of Peterborough has been working very hard on this. they have a number of contingency plans in place, and they have made arrangements with a number of motels so far that the rooms will be made available to our homeless individuals if they need to be self-isolated. The City of Peterborough will be paying for those hotel rooms, and the additional funding that we're providing will help offset the costs for them. I take my hat off and give absolutely the biggest kudos I can to the social services departments. We've met a number of times with them on what the plan will be moving forward. I think that they have come up with an exceptional way of dealing with all of this under all of the constraints. At present, all of the shelters have moved to the Sport and Wellness Center, but there are other contingency plans in place if we need to move some of those individuals from the Sport and Wellness Center.
Just a supplemental to that. So this means that some of the shelter, the homeless, now are they being tested? Are they being tested when they come forward or when they show signs or symptoms of COVID-19? How do we know that these people are the ones that need to be self-isolated?
We're following the protocols that have been laid out by the public health unit. And right now, it's if you have any symptoms, if you're showing any symptoms, they'll do an evaluation to decide whether or not you should be tested. Not everyone who has a symptom actually has COVID-19. Some of the symptoms are very similar to having a cold, to having different flus that are there. And our healthcare experts, they're the ones who make the decision whether or not someone should be tested. So we'll continue following that same protocol that's laid out by Peterborough Public Health.
Okay, thank you. I'm good.
Taylor, you have a question?
Yeah, thank you, Dave. I'm just wondering if you had any thoughts on how Peterborough has handled this crisis so far, not just the health unit, but the general public as well, and whether or not you think it's made an impact.
Taylor, I think that we've had some individuals who have done a very, very good job. I think as a whole, Peterborough is in a pretty good position. However, on a daily basis, we're still getting reports of individuals who aren't taking this seriously. We still get emails from individuals who think that we're overreacting and we shouldn't be locking down as much as we are. I learned this morning of a family who had just returned from Florida, and they went shopping at one of our grocery stores. That grocery store closed down the checkout area that they came through, and they have been sterilizing that entire area. There are still a number of people who don't take this seriously, who don't think it applies to them. And unfortunately, that's how the infection is going to move. It's not an airborne disease. It's a disease that's carried through the water droplets from breathing, basically. If people stay home, if people don't move around, then the virus cannot move around. And we can't emphasize that enough. If you don't need to go out, don't go out. If you're coming back from vacation, go straight home and self-isolate for the next 2 weeks. It's not just your life, it's your entire community. We cannot be in a position where we have a few people who aren't taking it seriously and are causing infections. We're seeing a number of people in this province dying as a result of this disease. And I think that when Premier Ford releases the projections tomorrow, it's going to be very sobering for many, many people.
All right, perfect. Thank you so much, Dave.
Any other questions? Mr. Barker.
Oh, yeah. Now, going back to the money that is being donated specifically for services in the Peterborough area. Now, is there a set limit on how much the organization will get, or is it just case-by-case basis?
So the 1.1 million that we're giving to the city for this, that's being administered by the city itself.
Okay.
At the provincial level, we've done an assessment on what each community needs, but we're not, the ministry is not at the ground level. The municipality is. They know which organizations are doing what and what their specific financial needs are. So I can't give you a dollar value and say that this is the maximum amount that one of those organizations is going to have. Those decisions will be made by the city itself, because they're the ones who are right there at the front lines and know what the needs are and how they're addressing it.
All right, thank you.
Any other questions? All right, thank you very much. Please, if you don't need to go out, don't go out. Everyone stay safe, and God bless each of you. Thank you very much.